Hey everybody, how are you? I just wanted to stop by quickly. I was seeing a patient earlier, and this was a common challenge, and it's pretty, I don't know, I think you'll find it interesting. So, this is about some of you out there who have issues with your bone health. Let's think, different issues with the bone health. Let's say it's osteoporosis, which osteoporosis is something that becomes more common as we get older and blah, 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 but there's other things that deal with that. Anyway, had a patient who had a challenge and he didn't know about the importance of vitamin D. Once again, in this medical world, he was kind of talked around, right? He knew that his bone health, or heard or learned that his bone health wasn't where it needs to be. Typically, a lot of my patients who have that are women, but in this case, so he was kind of talked around, just knew that he's supposed to take this calcium, but he had so many other meds and was like, Doc, I can't take it. I don't really want to take it. So plus I don't know if it's important. It's just calcium. Well, I'm here to tell you, calcium is incredibly important. And so if you or any of your loved ones, or think about your grandparents or your parents are dealing with calcium, understand the importance, because this particular patient was on some of the other medications out there that the endocrinologist can give, whether it be an infusion or whether it be some of the meds that are 1 day a week or even one pill a month that can help with that. I want you to just listen, because we'll do kind of a quick science lesson. You know how I am about the medical jargon thing. So let's break it down into digestible pieces. So think about your bone right here, right? You're looking here at your humerus, your bone, and every bone is like this, but there's different cells. There's osteoblasts with a B that build, and there's osteoclasts with the C, which kind of break it down. So there's always this balance each and every day with the osteoblasts building and the osteoclasts breaking down. And so we obviously, if your bone health isn't where it needs to be, we want the blast to be doing their thing and blasting that bone into health. But vitamin D is important for that, right? Because you know I'm a vitamin D person. I was blessed to get an award of vitamin D, because vitamin D is like my favorite vitamin, my favorite supplement. And vitamin D is important to do what? To help absorb calcium. So I had to explain to the patient that, number one, you need to make sure your vitamin D is right, because it helps to absorb calcium inside of the small intestine, two different areas of the intestine, one called the duodenum, the other one the jejunum. We'll talk about that another time. But the point is, vitamin D is important, so I had to make sure he was okay there, and then I had to let him understand that calcium is huge, because in order for those osteoblasts, remember they're building the bone, they need to make sure they have calcium, and they need to have calcium along with vitamin D, making that calcium to make them grow stronger, to make them build stronger. Now that calcium, or I should also say that vitamin D is important, because vitamin D, not only does it help you absorb that calcium, but it also keeps the bone from breaking down a bit as well, or resorbing as we call it. So vitamin D, calcium, big interplay when you're talking about your bone health. So I step back, let the patient know, hey, there's osteoblasts, because they do what, guys? They build. And osteoclasts break down. Always a balance. You need vitamin D, but vitamin D can't do its thing if it doesn't have calcium to absorb, to put that into the bone to help you really grow. So I share all of this. That's all it takes, is a discussion. It just takes a discussion of listening, not hearing, but listening to the patient. Because here it is. Imagine I didn't catch up with that patient. He would have been off on his own, not getting the benefits of the bone health, because he didn't understand the interplay of why calcium was so important, along with his vitamin D as well. So this is just important, just to make sure that don't let some of the challenges with being heard sometimes, or just not wanting to deal with it, get in the way of your health. And it almost got in the way of his health, but we said no. We put a stamp on that, didn't we? So hopefully you were able to appreciate the importance of bone health and how to go about it and the interplay. If you have any questions around that, or anything that's just giving you the S word, remember we call that stress, and just like throwing up your hands, don't throw them up. Let me know. Maybe I can make it a little bit easier for you. So anyway, if this helps you or someone near you, by all means, please like and subscribe so that we can continue you on your healing journey. Take care, guys. Talk soon. Hey, everybody. Dr. Ken Redcross here. If you don't know, I love the patient-doctor relationship. It is so important. So my question for you is, who wants to live longer? We all do, right? So therefore, I've written 2 books. This first book is called Bond. It's the importance of trust, respect, empathy, and communication with your doctor, because I believe if the relationship is perfect, then it will help you live longer. But how can I really make sure you live longer? Well, I decided to write a second book. This is the 15-minute Bond Blueprint. This particular book helps you go minute by minute of your 15-minute visit to make sure you get the perfect doctor relationship and visit that you all deserve to make sure we extend our healthcare journey.